Hello everyone, welcome back. My name is Bukola. I'm a medical doctor who currently practices in the United Kingdom. In today's video, I'm going to be discussing a common skin condition with you guys, which I myself have experienced in the past. The name of the condition is acne vulgaris, which some people call pimples. In this video, I'm going to be discussing acne profoundly by discussing the pathophysiology of acne, complications of acne, how you can prevent acne, and also I'm going to be going through my daily skincare routine with you guys, and that is where I'm going to be introducing you guys to the Luna 2 by For You, which I have learned to incorporate into my skincare routine. I'll be telling you the advantages of incorporating the Luna 2 into your skincare routine as well towards the end of this video, so stay tuned. So first of all, what is acne? Acne is a skin condition in which there is chronic inflammation of your hair follicles, which occurs when your hair follicles become plugged with dead skin cells and oil. So what is the pathophysiology of acne, or how does acne occur? Before I go in deeper into explaining acne, I would quickly like to brush through the basic skin anatomy with you guys. So basically, the skin is divided into 3 layers, which is the epidermis, the dermis, and the hypodermis. The epidermis is the outermost layer of the skin and is a home to melanocytes and keratinocytes. Melanocytes produce a pigment called melanin, which gives the skin its color, whereas the keratinocytes produce keratin, which is a special protein which makes up our hair, our nails, and our skin itself. The dermis is the middle layer of the skin, and it contains the sebaceous gland, the hair follicles, and the hair shafts. The sebaceous gland helps to produce sebum and oil, which helps to keep our skin moisturized. And finally, the hypodermis. The hypodermis is the innermost layer of the skin, and it's a home to adipose tissue, which helps to keep us warm. Now that we've spoken about the basic skin anatomy, it is time to discuss about the pathophysiology of acne, or how we develop acne. So in those people who have acne, their sebaceous gland is overly sensitive to hormonal changes, such that it begins to overwork, and when the sebaceous gland overworks, it produces more sebum. So naturally, sebum helps to keep our skin moisturized, but when it is too much, there is a bacteria which normally lives on our skin without causing any harm. But when this bacteria senses too much sebum production, it practically starts proliferating. The name of this bacteria is propionibacteria, now known as Cortibacterium acnes. It starts making extra copies of itself. And what happens to the body? The body senses this as a threat and produces chemicals to stop this action. Doing this leads to chronic inflammation of our hair follicles. So now it is safe to say that in order for acne to occur, the sebaceous gland has to overproduce sebum, there has to be accumulation of dead skin cells, and there has to be propionibacteria producing so many copies of itself. That said, so what are the risk factors of acne? So anything that can cause hormonal changes, such as puberty, pregnancy, a medical condition known as polycystic ovarian syndrome, using progesterone only pill as a family planning method, or any family planning method that contains progesterone, such as Mirena coil, would increase your risk of getting acne. So that said, another thing that can increase your risk of getting acne is using comedogenic makeup. Comedogenic makeup are those makeup that have the propensity to plug or block your pores. And also, studies have shown that having a 4th degree relative with acne would actually increase your risk of acne, which means if your mom had acne, or your dad had acne, it's a risk that you can actually develop acne in the future. Now that we've spoken about the risk factors of acne, let's talk about the complications of acne. So complications of acne depends on how severe your acne is. So complications of acne include acne scarring, which could be indented or atrophic scar. That means that a scar that is deeper than the surrounding skin, or hypertrophic or keloid scar, which means a scar that is larger or raised than the surrounding skin. Another acne complication is acne hypopigmentation, which is when a portion of the skin is lighter than the surrounding skin, or acne hyperpigmentation, which is when a portion of the skin is darker than the other part of the skin. Now that we've discussed about the complications of acne, let's quickly touch what a typical acne looks like. So a typical acne appearance would be a mixture of oily skin, blackheads, whiteheads, nodules that looks like cysts or burrs, and then pustules that has pus in it. And also some might actually be painful to touch, and some could actually give you a fever. So now I would like to answer some questions related to acne complications. The first question here is, why is acne common in people with skin of color? And the answer is, several epidemiological studies have been done in order to ascertain if acne is more common in people of color. However, it is unclear if ethnicity is truly associated with acne, although black individuals are more prone to acne hyperpigmentation because of higher levels of melanin. The second question here is, how does keloid or hypertrophic scarring occur, and why is it more common in people of color? So normally when the wound heals, it leaves a scar. A keloid scar is a type of scar that becomes thick, lumpy, and raised, and is usually larger than the original wound, whereas a hypertrophic scar is actually raised but not larger than the original wound. So why is it more common in people of color? So basically, because people of color have higher melanin increases the proliferation of a special type of cells called fibroblasts, which in turn increases the production of collagen. So studies have shown that keloid or hypertrophic scars contains high amounts of collagen. So it shows that it is actually related to the fact that people of color have higher melanin levels. So how do we prevent acne? In order to prevent acne, it is imperative to have a good skincare routine. So how do you achieve that? Setting an alarm on your phone and being intentional about it. In order to prevent acne, you need to have a good skincare routine, which involves cleansing your skin daily, moisturizing and toning your skin, and staying hydrated. So in order to clean your skin, or in order to have a good cleansing regime, it is important to have the Luna 2, which uses sonic cleansing to help deep cleanse your pores. Research has shown that sonic cleansing is able to remove pollutants from your skin. It's able to remove dead skin cells, sweat, and oil deeply where the surface of your hand wouldn't be able to reach. Luna 2 has been designed to reach there, and it also has finger-like projections, which also helps to deep cleanse your pores. So I've benefited tremendously by incorporating the Luna 2 into my skincare routine. So I started using the Luna 2 about 6 months ago, and I've actually seen a tremendous improvement in reducing the size of my pores. And the fact that I suffered from severe acne in the past, I have some scars, some hyperpigmentation on my face, and using the Luna 2 has actually helped me to reduce all of that. If you are the type who crave healthy and beautiful skin, I strongly recommend that you incorporate the Luna 2 into your skincare routine. And if you're suffering from severe acne, which is already affecting you psychologically, I recommend that you see a dermatologist who would offer you a vast variety of treatment option plans for you. So I'm going to be taking you guys through step by step of my skincare routine. So the first thing I'm going to be doing is to wipe off the makeup I've got on my face, and I've also got the other things that I would need here, starting from the Luna 2, which is the star item, my makeup remover wash, and my regular facial wash as well. I've also got my moisturizer here with me. The first thing you want to do is to make sure that you wash your hands, and after washing your hands, then you start wiping off the makeup. All clean. So basically, the first step in your skincare routine should be you washing your hands and making sure that it's clean. Then the second thing I'm doing here is to put some water on my Lunar 2 itself and put my makeup facial wash first on the Lunar 2 wash surface, and then start using it to massage my face. So you can see some makeup products on the surface of the brush. Then go next with my regular facial wash and then do that. So I basically do this process only when I do makeup. Without the makeup, I skip the first process and just go on to my regular facial wash. And now I'm rinsing that off. Then using a clean towel, facial towel, to dry my face. And this is when I would be putting my moisturizer on my face. This is the moisturizing step now. So I'll just dry my Lunar 2 and then apply my moisturizer on the anti-aging surface of the Lunar 2. I start massaging my moisturizer into my face. Now, one of the importance of moisturizing your face is the fact that it makes your face soft and moisturized, such that your sebaceous gland won't want to compensate by producing more sebum, which could in turn increase your risk of developing acne. So now you can see that my face is well moisturized, and yeah, that's it. Thank you so much for watching. If you have any question, can you leave it down below? I'll be very happy to answer.